And what we found in our work is that when we treated, there's a study with 150 people, when we treated people with pain reprocessing therapy, 2/3 of them had a full recovery from chronic back pain.
A full recovery?
Full recovery. We're talking about 0 or 1 out of 10 pain.
Wow, you can't believe that, but you did if you watched the Today Show, a new drug-free treatment to pain. Yoni Yashar is the leading researcher for a study at CU Anschutz Medical Campus. He told the Today Show their study showed success in psychologically stopping pain. It's called pain reprocessing therapy, or RPT, which sounds fascinating, and there's so many people dealing with pain, so we bring in Dr. Coley to talk about this with us.
Yeah, it's incredible. This study is actually based right here in Colorado, which is incredible. But break this down. So I know it's kind of focused on low back pain. Just how common is that? Why start there with this technology, or
You know, it's so common, and we have no good treatments for low back pain. So, they say 4 out of 5 Americans will experience low back pain. In fact, everyone at some point in their life might experience low back pain at least once. And the problem is we just have a big gap when it comes to understanding the reasons and the treatments for low back pain. So we're often left giving them treatments like chronic pain medicines, like non-steroidal anti-inflammatories, which can cause ulcers and arrhythmias and bleeding and kidney damage. Surgeries, which are not very helpful, because a lot of times even after the surgery, your body still kind of remembers the pain. Chiropractic, acupuncture, all these types of treatments that really just don't work and leave a hole.
When I saw a little bit of something he did before, he said, let's remember, this pain is real. It's very real. And, sometimes I think it's dismissed. It was when someone complains about pain, you go, yeah, but maybe you're just having a bad day. It's not, it's real. So how are they using this?
Yeah,
therapy?
so the very important acknowledgement in the study is that it's not just in your head, but it is in your brain. And so it's not that you're not feeling pain, it's that your brain is playing a trick on you and making you think that something is a noxious stimulus, that you should feel pain when you really shouldn't. So I'll take you through it. Essentially what happens the first time you have pain doing whatever, you send the signal of pain to your brain. Your brain triggers a fight or flight response, which then lowers your threshold to feel more pain. And so it amplifies that pain signal. And then the brain kind of neurons that wire together, get stuck like that. So very little things can trigger that noxious pain stimulus. So you kind of remember that pain, even when there's not a threat to the body happening. So the idea here is to change your reaction to the pain. Not to say that there's no pain, but to change how your brain reacts to it, and that's how you change how much you feel.
Does this really work?
Well, and that's what's incredible about this, Alex, is that this was a randomized controlled trial. That means some people got placebo injections in their back, like they got saline injected into their back. Some people got regular physical therapy, and some people got this PRT, pain reprocessing therapy. And there was a clear signal, and it wasn't just how people felt, but if you image their brain on functional MRI, which looks at the blood flow going to the brain, the areas for pain didn't light up as much. So they had fewer areas getting blood flow to the brain. Therefore, there was objective evidence that they were actually feeling less pain. So it's really incredible.
Because I would think that, honestly, stress can bring on this pain. I mean, when any of us are like, you feel more pain. So what do? They have you meditate? What do they do? Put you in a room? I mean, how does this work?
Yeah, so it's a multifactorial approach to this PRT, pain reprocessing therapy. So it's just like when we have an anxiety disorder, when we have PTSD, how do we sort of talk ourselves out of it? The first piece is education, teaching them how pain signals work, teaching them what pain is, teaching them how the brain responds. The next is sitting with them while they're having pain, talking them through the somatic sensations and giving them that sense of safety so that they focus on something else. So the meditation, the mindfulness, the kind of deconditioning your brain pain response, and then having them come up with solutions to talk their brain kind of out of it. Cognitive behavioral therapy. My MRI looks great. Oh, pain is not so bad. Oh, pain is not hurting me right now. All the positive messaging, which actually really helped.
That's incredible. Quickly before you go, I mean, what is the future? It's a study now, but the future impact on the millions of Americans that suffer with low back pain.
I mean, I think this could change the where we start. We always say, go to physical therapy, go do some exercise,
Yes.
go to a chiropractor. Now we start with CBT, we start with PRT, pain reprocessing therapy. This could be applied not just to back pain, to chronic cancer pain, to all types of pain. The billion people worldwide that are suffering with pain. We could get off, fewer people on opioids, fewer people on pain medicines.
Wouldn't that be amazing?
So I think it's a scientific breakthrough in neuroplasticity and using our brain to gaslight ourselves out of pain, basically.
Gaslight ourselves out of pain. That makes it very clear what's going on there.
That says everything. Oh, Dr. Collet, it's exciting. See, sometimes you have to tell us bad things. This is kind of exciting. This is a good
Usually we worry. We're like, oh my gosh, what's happening with
What
us
else am I
today?
doing wrong?
Exactly.
So
I need to go to the doctor.
The next time you guys have a headache, you can gaslight yourselves out of it, right?
We'll try.
I'm not having a migraine.
I'm not.
Everything is fine.
Thank you, Dr. Coley.